of digital health, navigating the digital landscape, and we're going to be discussing telemedicine and digital mental health in school, home, and in the workplace. I'll be your moderator for the session, Dr. Marie Claire Wangari, and I'd like to invite three ladies for this panel. The first one being Sharon Mwende Kioko. A round of applause as she makes her way to her seat. Sharon Mwende Kioko is a psychologist with Penda Health. Next up is Dr. Ms. Marie Othiambo. Let's give her a round of applause as she makes her way to the stage. Marie Othiambo is a Service Delivery Associate and Clinical Psychologist at Shamiri Institute. And then last but certainly not the least is Grace Lilian Murugi, a HR professional from Riziki Source. Let's give her a round of applause. All right, so this is my wonderful panel that we have, and in 30 seconds or less, let's say 1 minute maximum, just introduce who you are and what your organization does with regards to navigating the digital landscape.
Okay, hi guys. Hi. I'm Sharon Mwende Kioko, a psychologist at Penda Health. We offer telemedicine, and we've been trying to integrate mental health into the primary health care.
Okay. Hi everyone. My name is Marie Othiambo. I'm a psychologist and a program associate. It's just program management at Shamiri Institute. I believe if you were here this morning, you would have heard Veronica speaking. She was our director of service delivery. So what we do at Shamiri, we offer sessions, mental health sessions, to students in public high schools across the country. Based on character strengths, and we also offer free counseling as well to the students, or subsidized counseling, not free, subsidized.
Hi everyone.
Hi.
My name is Grace Murugi. I am 151 centimeter. I am wearing a green shirt with black dots, black pants, and black shoes. I have a black wig too. I work at Riziki Source as an intern, programs intern. What Riziki does, it connects persons with disability with potential employers. We have the RISE program and the G&I. Just in case you want to collaborate with us, please you can reach out to our employer relationship officer. His name is Fred and he's here. Hi Fred. Yeah. So that is basically what we do. Thank you.
Thank you for that brief introduction. So I'll start up with a question for all of you to answer. As Kenya embraces a more digital future, what are the key actions that need to be taken by the government, tech companies, and mental health professionals to ensure that mental health is prioritized in our digital system? What role do you see for innovative technology in shaping a mental health strategy that works for students, professionals, and the youth? So we could start with you, Marie, since you're holding the mic.
Sure. So I think to answer this question, I would say it boils down to two main things. The first is resilience, and the second is adaptability. So when it comes to resilience, I think we've spoken a lot today about digital access and increasing internet access and everything among students in different sectors, but I don't think that it's enough for governments and tech leaders to just focus on digital access if they're not also teaching people how to be safe in these spaces, and we've spoken about that. But I think that alongside these things, there needs to be campaigns about digital resilience, schools and communities are getting more connected, but we're not teaching them the realities of what they're being connected to, right? We're giving them Wi-Fi, we're giving them phones and all of these things, but we leave and we say, okay, cool, you're connected, and then afterwards, all of these issues come up and we're surprised because they weren't ready for what we were exposing them to. So I think we need to be teaching people how to disengage, how to stay safe, how to be aware of the different things that are online, the phishing, I believe someone mentioned that before, harassment, grooming, all of these things. For mental health providers, it's about creating a safe space to foster that resilience as well, because I think what comes with digital access is the idea of escapism, so you're escaping reality to go into these digital spaces. So if that's the case, then that means we have to make reality a safer place so that people can come and talk about the issues. And the second would be adaptability, because we've spoken about, what age we were when we got our first phones, when we had access to the internet and all of these things. But the realities that I had when I was 14 are so different to what a 14-year-old is accessing now, is being exposed to now. And if we don't keep up with the way that the digital world is developing, we're going to get left behind. And all of our responses are going to be reactive instead of proactive. So we need to be doing research. Our platforms, our policies, all of these things need to be proactive as well. At Shamiri, we do a lot of research, and an ongoing project that we're doing now is looking at the relationship between adolescent mental health and digital stresses. And it's not done yet, but some of the preliminary data is showing really interesting stuff about how the time spent on social media does affect mental health outcomes. People who spend over 3 hours a day have increased or elevated symptoms of depression and anxiety, but at the same time, it's not just about restriction or abstinence, because interestingly, it also shows that the people who are spending around 30 to 60 minutes online have increased levels of self-awareness, body positivity, things like that. So I think our research, our policies, all our approaches need to be hand in hand with digital advancements rather than reactive or resistant. Thank you.
Concerning the future of digital mental health and innovation, I propose family mental wellness kits. They will be delivered through voice notes, SMS, and in local languages, because it's a barrier, especially when you meet a patient who's not sharing the same language that you speak. So there's also practical tips on parenting, managing emotions, and stress relief. It should be an accessible right from a basic phone, it being a low-cost quality solution, because mental health access shouldn't depend on income or location. So tech does not replace the human heart. It helps replace. It helps to reach it. Yeah.
Right. And lastly, Grace.
For me, I would propose it should be accessible for PWDs. Accessibility first design mandates. Government and regulatory bodies like the Communications Authority and Ministry of ICT should require all health tech platforms to follow WCAG 2.1 standards, ensuring compatibility with assistive technologies from the ground. Inclusive language platforms should provide audio-visual translation in Swahili and KSL, that is Kenyan Sign Language, and simple content to be understood by persons with intellectual or learning disabilities. Thank you.
Thanks. And just now to go a little bit deeper, Sharon, in what ways can affordable tech-enabled primary healthcare systems transform digital mental health wellness access for youth and families in under-resourced schools and communities?
Okay, at Penda Health, we've seen that affordable and tech-enabled primary care can be a powerful gateway to mental wellness, especially for youth and families in under-resourced communities. So basically, primary care is often the first safe space for families to come to, not only for physical illnesses, but also for when they are quietly struggling with stress or emotional pain or behavioral issues in children. That's why we are trying to integrate mental health screening tools directly at the triage system. So when for example, when a parent brings in a child and they brought the child because maybe they're coughing or they're having a stomach pain or upset, we also get to check for emotional distress. It's a small step, but it opens up doors to much more deeper conversations and early interventions. So some of you were talking about cyberbullying, Cindy, at the beginning of the meeting. Some of the mental health stressors are digital fatigue, anxiety, is the job loss for the teachers or any other caregiver, is the burnout and screen addiction, cyberbullying. You get to pinpoint these things. As much as a patient amekuja for primary care, they've come maybe for cough, fatigue, you get to have a deeper conversation with them and get to know if they're having mental health stressors. So one way of integrating the mental health into the screening tools into our triage system is by trying to collaborate with the clinical officers and the providers, the CCs, the customer cares, to try and look out for people who are in need of more help or need more intervention. One of you asked about GBV, how you'll be able to pinpoint someone needs help. So some of the key things is to try to create safe space for them and try to know the common signs that they're going through, maybe unexplained bruises, injuries that vary from healing stages. There's also the body language and the validating screening tools that we've been talking about. So by integrating mental health into the primary care, we get to work with the clinical officers and the CCs to get to provide quality health care to the patients. So I've been collaborating closely with the providers and customer cares team to ensure the conversations are handled with compassion, dignity, and cultural sensitivity. This teamwork has helped us to catch what might be otherwise missed. There's also the low-cost quality solutions. So accessibility, convenience, affordability, and availability. We exist to lighten the burden to ensure that you don't worry about healthcare and that it does not stand between you and living your full life. Yeah? So one case would be maybe a patient amekuja with a cough, they're complaining about a cough and a stomach upset, and then you do more digging and you realize that this patient, maybe they're struggling with anxiety or maybe they're struggling with bullying and they're not able to reach out for help. So by collaborating with the CCs and the clinical officers, we get to provide help that they wouldn't have been able to ask for. We also do a follow-up through teletherapy by giving them calls and SMS. We've also partnered with Girl Effect. Through this platform, we get to get questions from youth, asking about their reproductive system, their relationship issues, depression and anxiety, and we get to help them at the comfort of their home. We've also tried to collaborate with schools through workshops, trying to educate the teachers and the students about things to look out for so that they can ask for help for mental health. For the clinical officers and the CCs, we do CMEs, continuous medical education, where we try to acquaint them with cases that they should look out for So like the things that I've talked about with GBV, the cyberbullying, you get to pinpoint that someone needs help. Yeah, so as Penda Health, we have platforms for Facebook and Instagram and WhatsApp and TikTok, where you can always access telemedicine at the convenience of your home, ask questions about what you need help with. We also offer virtual sessions for a fee of 500 shillings and in-person sessions for a fee of 1,000 shillings. So for the virtual sessions, a patient doesn't need to get to see you face to face. They can have the session at the comfort of their home. This collaboration has helped us to identify the patients that need help and offer help at the comfort of their home. Yeah.
Thank you. So my next question is to Marie. In the age of telemedicine, applications, and remote support, has Shamiri encountered challenges such as digital fatigue, cyberbullying, or screen addiction among students? And how do you recommend schools or mental health providers to respond to such digitally fueled issues?
Thank you. So just a bit about how we deal with clinical cases at Shamiri. So the people who run the sessions with the students are our lay providers, and they're the ones who have the direct interaction with the students. And if a student in a group has an issue, they take it to the lay provider, who then escalates it to a clinical supervisor. So that's our team of trained psychologists, counselors who deal with the students and the cases. So in the cases that we have had and looking through those cases, digital challenges don't exactly come up as a direct presenting issue. So it's very rare for someone to come up to say, I'm struggling with digital fatigue or cyberbullying or anything. They rather come up with other things such as depression, anxiety, and then as you dig deeper, as Sharon was saying, you find out that the digital issues are underlying. So an example of this, when I spent time as a clinical supervisor, just as an anecdote, I had a student who was dealing with a really tough personal issue, a personal trauma from her childhood, and we had worked through it over about 2-3 weeks of visiting the school. We worked through, she was showing a lot of improvement in the issue, and when I had gone back for our next session, she told me that someone in her school had found out about this trauma, about her secret. And before she knew it, within the week, not only was it spread on WhatsApp across the school, but it had reached many, many schools in the area. So people that she didn't even know were talking about this secret that was so personal to her, a story that was so personal to her, and it caused her a lot of emotional distress. So that's just, and it's something that we had to work through, something that we had to process because it was out of her hands. It wasn't something that could be taken back, even if the person was apologetic, it was out there, right? And this story really highlighted to me how dangerous social media can be and how this digital exposure can get so out of control, but also how this is the reality that our kids are in now. And like I was saying before, if we don't catch up to the reality, then we're going to leave a lot of kids behind, and we are going to be dealing with a lot of issues that are bigger than us because we don't understand it. And so to answer your question about recommendations for schools and for mental health providers, I think it just focuses on, again, the aspect of digital resilience, of preparing our students and our children on how to deal with these realities, how to set boundaries, how to make sure that they are as ready and as protected as they can be. So that would be helping them build digital safety skills. So things like setting boundaries, moderation, awareness about the things that they're going to be exposed to It would be creating spaces within schools or as mental health providers for them to talk about their experiences, either with each other as peer counseling or with adults who have taken the time to understand what it is that is happening on social media, what it is that they're being exposed to. And it's also equipping adults. So it's a call to the people in the lives of these students to also take responsibility as well. Not that they can control 100% what your kids are being exposed to, because kids are very tech savvy, more tech savvy than us. So if we are able to teach them how to be responsible as much as we can, understand what it is that is happening online, how to use these platforms that the kids are using so that we understand where the dangers are coming from. I think that would be good. And it's not about restricting or policing them, but rather being there to safeguard them and take care of them in these spaces. So that would be my
Thank you for that. And finally, Grace, how inclusive are current telehealth platforms and mental health apps for individuals with disabilities? And what features or policy shifts would you recommend to make digital mental health tools truly accessible?
First, I'll start by letting you guys know what telehealth is. It's remote diagnosis and treatment of patients using telecommunications and technology. So in telehealth, we have benefits and we also have challenges. So the benefits of telehealth we have, it reduces physical barriers. It eliminates the need for PWD to navigate transportation challenges and inaccessible physical environment to attend in-person appointments. It increases convenience. Remote consultation offer flexibility and convenience, allowing PWDs to access healthcare from the comfort of their homes. It actually allows or rather access to specialists. Telehealth can connect PWDs in remote areas with specialists, healthcare providers who may not be readily available locally. Continuity of care. For individuals with chronic conditions or mobility limitations, telehealth can ensure consistent access to necessary follow-up care. We have the challenges. Digital divide. A significant portion of PWDs in Kenya face technical and digital literacy challenges, limiting the ability to utilize telehealth services effectively. We have language and cognitive barriers. Apps rarely provide Swahili or Kenyan Sign Language support and often uses complex medical language that excludes persons with intellectual or cognitive disability. We have platform bias. Many services are optimized for smartphones, yet some PWDs, especially in the rural Kenya, rely on feature phones or shared devices. We have stigma reinforced by tech gaps. The lack of inclusive design unintentionally reinforces stigma by treating PWDs as afterthoughts, leaving them to rely on caregivers or miss out entirely in digital health services. So what I would recommend as a PWD, a person with disability, I would recommend subsidized access and assistive bundles. Leverage the NHIF and UHC framework to subsidize mental health teleconsults for PWDs and work with telcos like Safaricom, Airtel to offer assistive bundles that's of subsidized rates and for approved mental health apps. We have inclusive language and local customization. Platforms should provide audiovisual translation in Swahili and KSL. Simple content to be understood by persons with intellectual or learning disability. And and they should partner with organizations like KNAD and UDBK that can guide on this. Accessibility, first design mandates. Government and regulatory bodies like the Communication Authority and Ministry of ICT should require all health tech platforms to follow the WCAG AG 2.1. I had mentioned that when we started. Standards ensuring compatibility with assistive technologies from the ground. Thank you.
All right, thanks. Thank you. So I'll take 2 to 3 questions before we move over to closing remarks or comments. We have one at the back, Olena. We have a second one on this side. Any question from this side of the room? All right, great. So we'll start at the back.
Praise God. Hello. You guys, you are romantically sleeping. You guys are doing well. And we thank you for that. But it's so good, at least you'll one day make a testimonial in heaven that you were sleeping when sitting on a chair in a 5-star hotel. It's a good one. So I have asked a question. I think I should have done this earlier with the team that was on board. Having Odhiambo and the rest of the team on calls, and even Marie. I'm so just understand, like, at what age should we start addressing the issues of digital literacy, digital space? Because I'm working on something on changing mentalities, and we are struggling to understand, like, at what age should we make young people understand the context of issues gender. I know when it comes to gender issues, there's a lot of information, and that's my expertise, and also child protection. But I'm so just understanding, at what age should we start addressing this issue of digital literacy, considering the current developments within the continent and even Kenya? Thank you.
Thank you for that. My question goes to Sharon from Penda Health. You talked about counseling session being virtual, being 500 shillings. So what time does that cover? And is it services that we can share out with young people to let them know that they can contact the center? So do you have the capacity? I'm asking, the counseling session, the one for 500, how much time does it cover? Is it per hour, per 30 minutes, per 15 minutes? And then as an institution, do you have the capacity? Say, for example, I have a network of young people whereby you can share this information and they can be able to reach out.